area. So first we have to stop the bleeding, and for that, for stopping bleeding, we have to place a piece of cloth if available. If not, we can apply manual pressure by the hand, and then we have to apply a bandage in order to secure that piece of cloth and maintain it by stopping the bleeding.
Not now.
And then we have to fix the bandage. Now we have to give some medications to the patient, medications like painkillers and so on. So for that, first thing is intravenous access. So for that, cannulation procedure is being done. Then we have to give some medications to the patient. For that, first we have to do IV access, because we have to insert many medications in order to make sure that the patient is not punctured many times at different places. So we have to do the IV cannulation. And now the procedure of IV cannulation will be shown. The cannula should be inserted at an angle of 45 degrees until the end of the needle is inside the vein. The cubital vein, great saphenous vein, can be used for this purpose. And then we have to remove the needle and place the cap in order to prevent the backflow of blood from veins. And then we have to secure the cannula with taping. Now through this inserted cannula, we can inject few medications at the same puncture site without the need of puncturing many sites. The procedure of inserting medications can be seen now. While some medications are being given at shots, others should be given continuously through the IV catheter, IV cannula. While some medications are being given at shots through the IV cannula, others should be given continuously. So now we'll be showing you the procedure of how Medications are being given continuously through an IV line. So this is the IV line and this is the medication bottle. The blue cap right here is used for equalizing the pressure, and this bottle should be half filled, should not be fully filled at all times. The first step is to remove air bubbles in the IV line. For this we have to adjust the rate and remove the air bubbles from the IV line.
Keep bottle now.
We have to remove all the air bubbles. The part shown right there on the IV line is the part that we use to adjust the rate of flow. Now we are going to insert the IV line into the cannula. First we have to remove the cap. And then insert the IV line. You remove the air bubbles, right? So insert. After insertion, we can adjust the rate depending on the situation. This cap should be opened in order to equalize the pressure, and the rate of flow can be adjusted by the blue color. Depending on the situation, the rate of flow could be 1 drop per second. Depending on the situation, we can adjust the rate of flow of medication. So according to this, it's like 3 drops per second, and then like 2 drops per second, or it could be 1 drop per second. And we have to make sure that this bottle should not be fully filled at all times.
Speed it.
Now we are going to show you the Seldinger technique of applying the catheter into a patient. This is the J wire, the needle, the cap which is used to prevent the backflow of blood, and then we have the catheter, the syringe, and the medication. In this case we have heparin to prevent the clotting of blood inside the catheter. So now we'll show you the procedure of how it is being done. First we have to insert the needle and then pass the J wire through the needle into the vein, and then remove the needle. Insert the catheter through the J wire. This technique is called Seldinger technique. And then remove the J wire. Insert the catheter totally and remove the J wire. And then close it, secure it with the cap. The cap is being placed in order to prevent the backflow of blood, to prevent bleeding in the patient. If the catheter is to be placed inside the vein for a few days, we have to use an anticoagulant. This anticoagulant is being used in order to prevent coagulation of blood inside the catheter. So now we'll see how it is being injected. We have to inject it through the cap. The needle can pierce the cap because it is made of rubber. And the volume of heparin could be around 0.2 milliliters.